Greetings, cohort. This is Jocelyn. I'll be sharing the importance of selenium, a trace mineral that we need small daily amounts of. But it's an integral portion of DNA, immunity, and disease prevention. It was discovered in 1817 by a sulfuric acid works employee, Jan Jacob Brozilius. Not sure if I just murdered his name or not. Sorry about that. But he discovered a reddish-brown sediment at the bottom of the tubs where the sulfuric acid was being produced. Selenium is a non-metal element that has some metallic qualities, and its name is derived from the Greek word selene. This element has 3 oxidative states. Most notably, it's the 2- oxidative state that has the unique qualities that can be substituted for sulfur in a variety of chemical reactions within the human body. Selenium can be found in both animal and plant foods, but it's most abundant in Brazil nuts. Actually, Brazil nuts have the highest amount of selenium in them compared to all the other foods that are out there with selenium. It's also found in seafood, halibut, tuna, shrimp, organ meats, dairy, whole grains, legumes, spinach, and many of the vegetables in the brassica family. So that's your cabbage, your bok choy, Brussels sprouts, broccoli, cauliflower. And as you can see with this picture, there is also leeks and avocados. There's a small amount of selenium in avocados and the leeks and kiwi. But selenium is readily available in inorganic form. The selenite and seleninate, and forgive me for that collect in the soil. So that's how we derive it from our vegetables, and our vegetables get it from the soil, which is cool. These forms of selenium, these inorganic forms are converted into organic forms of selenomethionine and selenocysteine. These 2 organic forms of selenium can be found in the methionine-cysteine cycle. And I just want you all to remember that this element can replace sulfur in several chemical reactions, most notably the glutathione reduction when it's acting as an antioxidant. Selenium is an interesting mineral because it can be readily absorbed in both the organic and inorganic forms throughout the small intestine. And what you're seeing here is a picture of the enterocyte with the different forms of selenium being absorbed through that gut lumen. And once it's absorbed into the small intestine or into that enterocyte, selenium is either utilized by the enterocyte. And what's interesting about selenium is that it does not need to be digested prior to its absorption into the brush border of the gut lumen. There are a few things that help to enhance the absorption of selenium, and that would be vitamins A, C, and E, where there are also some inhibitors of that absorption, and that would be phytic acid. Increased levels of glutathione as well can really inhibit that absorption. So it kind of seems weird that brassicas have high amounts of phytic acid, but they also have selenium, so they kind of fight each other. So taking, I think, a little vitamin C or using a little citrus vinaigrette will help with the absorption of selenium from your foods, or drinking maybe a little glass of lemon juice might help, or even a little orange juice. So the selenoproteins and selenoamino acids that are thought to be transported freely across the basolateral membrane of the enterocyte. So once the enterocyte has either utilize the selenium, or it's passing on that and it's going to go ahead and allow it to pass through that basolateral membrane of the enterocyte into the hepatic portal vein, where it will then travel freely through the blood to all the peripheral tissues and organ systems. So with metabolism, storage, and excretion of the selenium molecule, those selenoproteins are stored primarily in the thyroid gland, and we'll talk about why a little bit later, the kidneys, liver, heart, pancreas, testes, and skeletal muscles. Minute traces of the mineral are found in the brain, lungs, bones, and red blood cells. Within these peripheral tissues, selenium is metabolized further. It's reduced from seleninate to seleninite, which is then further reduced to seleninide. And I want to make a note that if dietary selenium levels or intake increases, excretion of this mineral increases in the urinary tract. And there are no indications that selenium is excreted through the bowels, through the bowel movement. Oh, and both of these diagrams are showing you all that the process that selenium goes through and its different reactions within the body, which I, again, think are pretty helpful in understanding this mineral. So here we're talking about the biochemistry, physiology, and function of selenium. There are over 25 selenoproteins that act within the body. There are six important selenoproteins that play a role in the antioxidant function in the peripheral tissue. These are glutathione peroxidase, methionine sulfoxide reductase, selenoprotein P, selenophosphate synthetase 2. And then there's two catalysts that I know everyone is pretty familiar with because we studied it with iodine. And those two are integral in aiding in the thyroid hormone in reducing the high thyroid hormone of T4 to T3. This conversion is important in the function of the thyroid. So you can have a ton of T4 in your system. You've got plenty of the unconverted form of T4 floating through the body, and your numbers will read really great. Oh, your T4 numbers are great. But if you don't have the selenium to convert T4 to T3, you actually will have a deficiency in selenium over time. So here we have the recommended dietary allowance and tolerable upper intake levels for selenium for children through adults. Selenium has a UL of 400 micrograms for adults, and for small children, it's going to be about 45 micrograms for infants, and as they age, that tolerable level goes up ever so slightly, but not too high. And then the RDA for adults is about 55 micrograms for both men and women. For children, infants, 15 micrograms up to 20 micrograms, and then as they age, it increases ever so slightly. And we've got here for the ladies that may be pregnant, they're going to require about 60 micrograms of selenium, and then if they're lactating, they're going to also need a little bit higher than what the normal range for adults is, which is about 70 micrograms. Now, the toxicity of selenium is rare, but it can become an issue for those taking this mineral as a supplement over extended periods of time. Um, so the symptoms of of having a toxic level of selenium in the body is hair loss, brittle nails, GI conditions, skin rashes, fatigue, cognitive difficulties, and most notably, the garlic breath. And I know we haven't gotten to vitamins just yet, but I do know that there are some vitamins, if you have a deficiency in them, some of the B vitamins, you will also see brittle nails, hair loss, skin rashes, GI conditions. So I think they kind of go hand in hand, which I think is pretty interesting. So with the deficiency of selenium, it can be exacerbated by the deficiency of vitamin E. They kind of go hand in hand, which is interesting. A fat-soluble vitamin with a mineral, but they do go hand in hand. There are two types of deficiency related diseases: Keyshawn disease and Keyshawn-Beck disease, and hopefully I'm pronouncing those correctly. Keyshawn is expressed as the cardiomyopathy type of pathology. It'll show in congestive heart failure, and there will be a type of necrosis of the cardiac tissue, a hardening of that tissue, a deadening of that tissue as this persists. The development of the Coxsackie virus is thought to be a cofactor in bringing on this extreme deficiency of selenium. This form of deficiency is seen in select regions of China and Africa. Guillain-Barré disease is more closely related to an inflammatory response. The pathology is associated with arthritis or osteoarthritis and a degeneration of joints, specifically in the knees and ankles. And this disease can be seen in regions throughout Europe. And it's thought that those most at risk are the chronically ill who are receiving a TPN nutrition, which is a total parental nutrition or IV nutritional foods. And excuse me, those who have also gone through gastric bypass or may deal with like GI disorders such as colitis and Crohn's disease. And the assessment of selenium, it's reliable, of course, to test the serum levels, and those are related to the dietary intakes of selenium. So you're going to want to test the blood serum levels to find out where a patient is with their selenium in the tissue. Selenium is helpful in preventing a myriad of diseases. It aids in reducing the risk of type 2 diabetes, heart disease. It even has helped to reduce LDL cholesterol levels. Selenium is has anti-cancer properties and has been used in treatment of certain cancers. It has antioxidant properties and improves immune function. Some of the other diseases that selenium has been helpful in treating are cystic fibrosis, asthma, arthritis, and muscular dystrophy. This is the conclusion of my presentation. I hope that I was able to shed a little more light on how valuable and vital selenium is to the human body.